Hi everyone! This video will talk about the introduction to handwriting. Let's go!
So, what is writing and handwriting? Writing is a tool for communication that provides a means to project feelings, thoughts, and ideas. Besides, writing is a complex process that requires the integration and synthesis of memory retrieval, problem solving, organization, language and reading ability, graphomotor function, and ideation. Writing is really important as it is used to compose stories, write messages to friends and family members, complete written examinations, and copy number for calculations. Next is handwriting. Handwriting is a crucial skill for elementary students to acquire, and it is more than motor skill because it requires connecting the letter name with a letter form, recalling a clear visual picture of the letter form from memory, and being able to execute the motor pattern required to produce the form. The functional skill of handwriting supports the academic task of writing and allows students to convey written information legibly and efficiently while accomplishing written school assignment in a timely manner.
How many percent handwriting involves in school? Handwriting is very crucial and a main element of every child's school experience. The study conducted by Deborah et al. 2001 involving 30 to 60% of primary school students' class time is spent in fine motor and writing activities. Other studies by Graham and Herbert 2010 stated that over 90% of white-collar workers and 80% of blue-collar workers indicate that writing skills is important to successfully get a job. Next, handwriting process. The writing process is under the No Child Left Behind Act of 2001. This act is focused on ensuring that every child can read by the end of the 3rd grade and no child is left behind. This act focuses on enhancing students' literacy skills and to develop these skills by the contribution of school professionals. Below is the writing process that emphasizes this act. Firstly, literacy begins with the functional literacy, which consists of basic ability to read and write, which these skills required to manage everyday life. Next, literacy proceeds to reflect on knowledge of significant ideas, events, and values of society, which known as advanced literacy.
Handwriting readiness. Mastery in handwriting readiness before initiated handwriting instruction is important. Children may become discouraged and develop poor writing habits when children are taught handwriting before they are ready. Writing readiness skills have been further specified by several authors. If we think what foundation skills a child must have for writing readiness, Lim in 1979 outlined 6 prerequisites for handwriting readiness, including small muscle development, eye-hand coordination, alphabet recognition, orientation to written language, basic stroke formation, and utensil or tool manipulation. Also, Bembo in 1992 described 4 prerequisite areas for handwriting readiness, including dominant hand use, ability to copy the first 9 shapes of the developmental test of visual motor integration, proper posture and pencil grip, and midline crossing with the dominant hand.
Now, let's see about the development of handwriting. This is the table about the development of pre-writing and handwriting in young children following their age level and performance tasks. For age level 10 to 12 months old, the child should be able to scribble on paper. For age level 2 years old, the child should be able to imitate horizontal, vertical, and circular marks on paper. And for age level 3 years old, the child should be able to copy a vertical line, horizontal line, and circle. Next, for age level 4 to 5 years old, the child should be able to copy a cross, right oblique line, square, left diagonal line, left oblique cross, some letters and numerals, and may be able to write own name. For 5 to 6 years old, the child should be able to copy a triangle, print own name, copies most lowercase and uppercase letters.
Common condition for handwriting difficulties. Some of the common conditions that are associated with handwriting difficulties are dysgraphia. It is a neurological condition that causes difficulty turning thoughts into written language appropriate to the age and ability to think. Children with dysgraphia has difficulty writing in straight line, knowing when to use uppercase or lowercase, and writing letters in reverse. Another condition is attention deficit hyperactive disorder, ADHD. Children with ADHD have immature, messy and illegible handwriting as a result of weak motor skills and lack of visual motor integration. Children with dyslexia show difficulty writing quickly with correct letter formation. The students with dyslexia wrote more slowly and with more spelling errors. In addition, many students with dyslexia show signs of dysgraphia, including having illegible handwriting and taking a long time to form letters and write assignments. Lastly, autism can affect handwriting in numerous ways, such as a lack of fine motor skill, which commonly translate into legibility difficulties and impacts the way students are able to organize their thoughts within their work. Autistic children often know the information very well but struggle to translate this knowledge onto the actual page. Role of occupational therapy in handwriting. The role of OT is to view the student's handwriting performance by focusing on the interaction of the student, the school environment, and the demands of the school occupation. During the evaluation and intervention process, the occupational therapy will focus on the occupation of handwriting by determining which domains and which components of handwriting are problematic for the students. Next, the occupational therapy will observe the school context or environment that includes the educational, geographic, and social characteristic of school. For example, the curriculum and physical classroom. The occupational therapy must consider the student's personal context that includes the cultural, temporal, spiritual, and physical aspect to plan suitable intervention for the students. Next, occupational therapy must acknowledge the student experiences that are interfering with the handwriting production.
Measure handwriting performance. To measure handwriting performance, the teacher or other professionals will look at the domains of handwriting, the legibility components, writing speed, and ergonomic factors.
Thanks for watching!